Okay, I think we're good now. Thank you so much, Kristen. As Linda said so eloquently. This is on. It should be on. No? Okay, we're good. Sorry about that. Everyone at home, just got to do some sound check. So as Linda so eloquently said, it does give a lot of hope to hear from an adult patient. And I've heard some other parents say, we're so grateful to hear from someone today. But I think the question is, how do we get there? You know, we have this hope that this is a great time to be living with CF. Living with CF, that's the key. But how do we get through what we call these teenage years, through adolescence, to adulthood, to 20 years old, to 30 years old, to 42 years old? So I want to talk a little bit today. I'm going to do kind of a condensed version for the sake of time. I'll try to speak till about 4. But the good news is a lot of this information is adapted from a booklet that I'm going to be handing out to all of you family members today before you leave. So remind me before you leave today as you're heading out, and you'll get a copy of that. So this is adapted from Milestones in CF Care, which was through a generous contribution through Genentech, and it's authored by Lisa Green, who some of you got to hear speak at our Parent Education Day, and she's a CF educator and the parent of 2 CF children. So the road to responsibility. So I remember when I was learning to drive and had a learner's permit. It was very scary for everybody. I know now in California, I think it's 15 and a half you can have a permit. And you have, your parent with you. And it was my mom, refused to go with me. It was my dad my mom's like, there's no way I'm going to ride with you. That's too scary, too nerve-wracking. So my dad would go with me, and then we'd practice getting on the freeway, and we'd practice going long distances and parallel parking and that kind of thing. And I had to look it up because I know driver's ed has changed. So I think now, you have driver's education. So you learn a lot, you get the permit, you're behind the wheel with mom or dad. And then by the time, if you've done that for 6 months, you get an intermediate license now. So you can still drive, but I think it's only during the day. You have to have an adult with you, that kind of thing. And then after 6 months of that, of the intermediate license, you get finally a full-fledged regular license, either after 6 months of having the intermediate or at age 18. So there's a lot to get through before you have a license. And it's kind of the same with CF and with learning. You have to go through these phases, before you get the permit. You have the education. We'll talk a little bit about some of the education we want you to have. Before you can, drive on your own, you've got to be there with mom or dad in the passenger seat. And then notice I said passenger seat. So you're driving the car, we want you to be in control, but mom or dad still has some control, and they're sharing that responsibility on the road with you on this adventure of life. So roller coaster, as we saw, I love this slide earlier that Dr. Bava had with the teenage brain. So we know the teenage years can be full of physical, emotional, intellectual challenges. You have increased influence from friends. Sure, your parents are a big influence, but now your peer support, your friends are maybe a bigger influence than your parents. Changes in identity, personal development. This can be a time of stress, and there's a lot on your mind. Going back to that teenage brain slide, where does CF fit in all of this? You have a lot of other things, so many other things crammed in there. And so for a teen with CF, being in charge of your health care and gaining more independence may not really be on the forefront of your mind. It might not be a priority at all. It might sound boring or scary. And hopefully, though, you can develop a desire to learn, and you'll want to learn and have a space in your brain. We want you to still have all those things, friends and family and fun and school and sports and activities, but we want you to have some part in your brain for CF, because if you do, you have that balance, you won't be on this roller coaster. We want you to get off the roller coaster. It's fun for a little bit. I don't like roller coasters anymore. I used to. They used to be really fun, but it's nice to get off. It's nice to have a balance and to know that you can have room in your life there's always going to be ups and downs, teenage years or not, but that you have room for CF, and that, like Kristen said, it's just a part of who you are. It doesn't have to define who you are. It's not the only thing about you, but it is a big part of your life. And it's trying to find a balance during these tumultuous, these up and down years. Where does CF fit in? Next slide. So getting ready for the handoff. So a successful handoff comes together with hard work from everybody. It's from hard work from the patient, from the parents, but also the medical team. And that's why I'm talking today, just to how to prepare you and kind of to let you know what we do in the clinic if you haven't already experienced this, or in the clinic or hospital, kind of what social work, nursing, dietitian, what the physicians are doing to better prepare you and your children and your parents for this handoff. Transition can happen between 18 and 21, that physical transition of going to a new center, but it's not just defined by an age. This is something that's ongoing. We try to address this as early as age 8. And so I'm going to talk about transferring to the adult center. So we did talk about early in one of our breakout sessions, just engaging more with the team, letting your child or encouraging the team to talk directly to your child, or if you're the patient, stepping in and asking questions of your doctor, of your nurse, of your social worker. You can ask for a tour of the adult center. That's something that can be arranged, and your social worker can tell you more about that. Talking to the pediatric team about who the adult team is. Fortunately, a lot of our patients do transfer to USC, to Keck USC Medical Center if they stay in the LA area. And we do have the privilege of Dr. Rao, who is the adult lung doctor, adult pulmonologist, coming to Children's Hospital to meet you or to meet your child before you even go over to USC, which is great. And also the social worker, Martha, used to be a social worker at Children's Hospital, so she knows kids and she knows patients and their families from the child side and the pediatric side, but now she's on the adult side and she's actually the new social worker over at Keck USC. So it's great having that familiarity with her, and that's something that we're trying to implement more so at our clinic. So they come to your turf. Okay, you meet the adult team here at Children's where you're familiar, and then by the time you go over to USC, you've already met them here. And then asking about expectations at the adult center, and we want to prepare you as best as possible too, so that it's not as scary. Talking to doctors, common questions, that we encourage you to start asking if you haven't already. I feel fine. I haven't been sick in a long time. Do I really need to keep taking all my medications? I'm unsure of why I have to do this therapy or that therapy. Can you remind me why I have to do this? I mean, we want you to ask those questions. Sometimes you might not want to. Like, I feel like I should know why I take this. There's probably a good reason. I'm not actually really sure. Ask the question. The more that you know, the more it's more likely that you're going to follow through with the treatment if you know what it helps you do or what it prevents. I've noticed a change in my health. I want to discuss with you. Can I describe the symptoms? That's another question you can ask. I've started taking a new medication. We had the example in the play. What new medication? And the doctor had spent all that time talking about it, but was mostly talking to mom. Was talking to me. I didn't really understand what was going on, so I doubt Alex, 14-year-old Alex, had any idea what was going on. The sister certainly didn't either. So it's okay to ask those questions again, or to interrupt and say, I'm completely lost. Can we go over this again? Evolving roles. We've talked about, Dr. Bava talked about becoming the enforcer, or becoming the consultant, moving from the enforcer to the consultant. So parenting styles are going to adapt as the adolescent patient matures. Giving up or increased independence doesn't mean giving up control as the parent. It just means finding a shift in that role, becoming that consultant, growing alongside, with your child. Micromanaging doesn't lead to cooperation. We saw that with mom kind of fiddling in the pillbox, how irritating that must be, and that's not effective. So trying to avoid micromanaging. It's really about finding the right balance. Involving roles again, setting clear limits, responding to mistakes with empathy rather than punishment, discussing options, allowing some mistakes. Sometimes it's okay to allow for mistakes if you're teen or if you can learn from that. And in the play, we kind of see how the mom is conflicted, and she says, I just want to do the right thing. And I'm sure a lot of parents have thought that. Kind of put your hands up, like, I want to do the right thing. I'm not sure what that is. And we see that desire. It's just trying to find what that looks like for you. Finding a support network. I think one of the most important things at this time for adolescents, as I talked about, your friends become more of an influence, maybe the most important influence in your life, is to finding a good support network, a healthy support network, friends, a church community, teammates on a sports team. And I think rather than hiding your CF or having your child hide his diagnosis, actually opening up to somebody that they trust, a friend, can actually benefit them greatly, especially during this time of adolescence. And it can make a big difference in how you live your life. Looking at a checklist, and we do go over these, we hand out these checklists and we go through them in clinic, social workers are going through them, nursing is addressing this, but just so you know, they're broken down into different stages, and this particular one is looking at ages 12 through 17. So these are things that we would hope would be learned. If not already, we have some 8 to 10-year-olds who are already doing this, but can describe symptoms, recognize warning signs, that would initiate a phone call to the doctor, taking care of daily CF without having to be reminded, without, did you do your vest? Did you take your enzymes? Did you eat lunch? Did you take the Actigol? That hopefully in this time period between 12 and 17, this is something that patients are learning to do on their own. Asking healthcare provider questions that we talked about, and then meeting with healthcare providers by myself. Something that we're really trying to implement and practice at Children's is to, and hopefully in other centers as well, starting at age 15, that the patient has an independent visit. So this can be independent, maybe starting with social worker, and then with the nurse case manager, with dietitian, and then eventually with the doctor. And the first half of the visit is independent. It's an opportunity for the patient to answer questions by themselves. And as I used the example in the breakout session earlier, I have the tendency of doing this. I talk to mom or dad when they're there, how's Alex doing? Alex, are you taking your medications? And I'm not looking at Alex because I'm used to the parent being in the room. Sometimes when mom or dad is physically removed, they're waiting down the hall, and we have time to just talk to the patient, it really opens up that space for them to say, oh, this is cool. Like, I don't have mom or dad here. This is a safe space to talk to the social worker, and I'm on my own and I can speak up. And maybe I've wanted to before, but I'm kind of used to mom just answering questions for me. So this really allows time for the child, or the patient, they're not a child, for the patient to engage with their medical team. And that's what we're trying to encourage starting at age 15. So that when patients come to the clinic, we have a lot of 18-year-olds that come by themselves. If they're driving, they got the driver's permit and learned all that. They come to clinic by themselves, and they've been practicing or been able to engage with their medical team for the last 3 years. So this is nothing new, and they're doing it on their own, and that would be our goal. Also, as the checklist continues, just making healthy choices about smoking, alcohol, drug use, and again, making good choices about who you choose to be friends with and who your support is. Empowering parents and patients, really just to summarize, Lisa Green summarizes this best. Transition is not just about following a checklist. The checklists are important and we do have them for a reason, but it's about empowering parents and patients to prepare a young adult for complete independence. I really like that quote. I think it does summarize nicely, though I have a few more things I want to talk about. Shifting the balance of power, we talked about evolving roles. The balance of power shifts in a young adulthood. There's no denying that, right? Parents have less power, okay? A lot of the power is maybe going to peer groups, to friends. But the power that they do have left, hopefully there's some power that they can use that wisely. It's important, as your child becomes a young adult, to use the power you have carefully, or else you might lose them. They might just walk away and completely go to their friends for everything. And so it's trying to just find that balance. As we talked earlier specifically about the transfer for Keck, can we go back to Keck? Yeah. To Keck USC, which is, again, some of our patients might go to school out of the area or out of state. So we would find a center, an adult center for them to go, but a lot of our patients do go to Keck USC. So there are questions, what information do I bring with me? Who do I talk about insurance coverage? I'm stressed out. These are all very good questions. So we're really here as your team to support in this process. It's something that we don't talk about one visit, we talk about for several visits. And we've actually just started an algorithm where the social worker is going to specifically have a visit just to talk about insurance coverage. We won't get too much into that today for time, but something called GHPP. And that's something that we've carefully thought out because we've seen patients go through the transition, and we found ways that are going to make it a lot smoother for everybody, even down to logistics of insurance. Feeling stressed out is a normal emotion. This is a big time for everybody, not just for the patient, not just for the parent, but for us too as the medical team. It's a shift for everybody, and so we're trying to find ways to make it smooth, for everyone. So going to the checklist, just 18 to 21-year-olds. So some of the same things, hopefully they're already in charge of their care. But other things we add on to the checklist at age 18 to 21, knowing when to order more medical supplies, calling in pharmacy refills, maintaining a notebook, probably not this old school notebook, but as we talked about, there's something called, that Daniele talked about, the CF notebook application maybe on iPad or smartphone, it can be an electronic notebook. Just a way to track changes and goals. And in the book that we're handing out, there actually is something to get the patient started. It has like a little checklist, and then it has a space to write goals and that kind of thing. Responsible sexual health, plans for college or career that fit with CF, and then ready to be a health advocate. So these are some additional goals that we would look at for that age group. Being open and honest about CF. I talked about just having a peer network where you feel comfortable. Hopefully family has already been supportive, but having that peer network. Not everyone needs to know about CF. You can decide, who you want to disclose that to, but if you have a close friend or significant other, I think it would be really important they should probably know, and it would help you just how you live out your life. And chances are when I've talked to patients who, when they finally shared about their CF with a close friend or someone, the friend has been really supportive, and it's actually just opened up for a lot easier just to be able to live life. Again, CF doesn't define you. Doesn't have to define everything that you do, but it is a big part of who you are, and so why not share that with people that are close to you? Again, talking about my health notebook, just any way that works for you, whether it's electronically or on paper, just tracking changes in health, changes in behavior, medications, questions that you want to bring to your doctor, notes from visits, and to track therapies. And finally, just I think having a vision is key. As Kristen said, it's my CF. It's your body, it's your life, it's your CF. And having a vision as how you want to thrive as an adult is key. To figure out what is your vision for life. What is my vision for life? Not just CF, but this is a really important time in life, and it's great to just capture that and have your own goals and how you want to live. So finally, just to conclude, the adventure ahead. So I think just learning more about CF, feeling more in control, being more independent is just going to help overall for you to enjoy the journey too. I mean, I think it's not just about getting there and getting to adulthood, but enjoying the journey on the way and enjoying the ride. Thank you.